So somebody wanted to know about cavernous sinus thrombosis and also its kin, which is the superior ophthalmic vein thrombosis. So both the cavernous sinus thrombosis and the superior ophthalmic vein thrombosis look similar. And the reason is the cavernous sinus is the major draining pathway for both the superior ophthalmic vein and the inferior ophthalmic vein, but predominantly the superior ophthalmic vein in the orbit. And so when that vein doesn't drain because there's a blood clot, thrombosis here, or in the cavernous sinus, then the blood can't go down the petrosal, back down the internal jugular vein, back to the heart. And so the blood is going the wrong direction, which we call retrograde, or it can't pass anterograde. And so what that causes in terms of symptoms and signs in the orbit are similar, whether it's SLV thrombosis or cavernous sinus thrombosis. There's going to be proptosis because when the vein can't drain, the blood gets stuck in the orbit. The eye's going to be red because of venous congestion. There might be increased intraocular pressure and increased intraorbital pressure from glaucoma and from increased episcleral venous pressure. There might be ophthalmoplegia because the muscles are all going to be enlarged from venous stasis, and that might cause diplopia. And you might have vision loss either from an ischemic optic neuropathy or central retinal vein occlusion or ocular ischemic syndrome. All of these are going to be the results of thrombosis in this location. And so there's really two types of thrombosis: the septic type, which is infectious, and the non-septic type, which is the non-infectious. And so you have to look for a source of infection in the septic ones: skin, sinus, blood, some source for sepsis. They're going to have fever and elevated white count, all the other features of sepsis. In the non-septic type, we have to do the hypercoagulable state workup and also be looking for the other causes in the Virchow's triad: trauma. There are other mechanisms by which you can get thrombosis, surgery, for example. And so the imaging studies are going to show the thrombosis and SOV enlargement with clot inside the SOV. That clot is usually visualized as hyperintensity on MR and hyperdensity on CT. And you might need an angiogram to confirm this. If it's septic, we're going to treat that with antibiotics, and you might have anticoagulation. If it's non-septic, we're just going to use the anticoagulation. These need to be admitted to the hospital because they're often very sick people, and if it's septic, we really need intravenous long-term antibiotic therapy as well as find the source. So both cavernous sinus and SLV thrombosis look the same. They have orbital congestion signs: proptosis, red eye, high IOP, ophthalmoplegia, diplopia, optic neuropathy, central retinal vein occlusion, or ocular ischemic syndrome. You got to look for this infectious source, and you got to treat with antibiotics if it's septic, and anticoagulation and a full hypercoagulable state if it's non-septic thrombosis.